Everyone, my name is Sahar Naderi. I'm the Regional Director of Women's Heart Health here at Kaiser Permanente, Northern California. I'm also a steering committee member for the iSCAD registry, as well as a scientific advisory board member of the SCAD Alliance. And I'm really pleased to be able to present this talk to you for those of you who may not have been able to attend the Atrium Health Conference. So this is kind of the fun part of these presentations because I get to present the lifestyle medicine 6 steps talk to you today. So the first thing I always want to say is you are what you eat. So many people already know this, but that's kind of one of the pillars of heart health is what you consume on a day-to-day basis. There's good literature that suggests that the Mediterranean and the whole food plant-based meal plans been shown to reduce the risk of major cardiovascular events. Now, a lot of folks will ask, well, did I do something with my diet that might have caused my SCAD? There's no literature to suggest that the heart attacks related to SCAD have similar lifestyle strains that might have contributed to them, but it's still important to make sure that you're healthy mind and body. So for those of you who are looking for meal plans that might be different from your current meal plans in terms of a nice, healthy, robust cardiovascular diet, these would be the two that I would recommend. One thing to note is a lot of people ask, well, plant-based, is that necessarily healthy? So that's why there's this clear distinction that this is whole food plant-based meal plan as opposed to maybe a high carb plant-based meal plan. And the Mediterranean meal plan is same as what you've historically known, minus the glasses of wine that are still on this lecture slide. There is some reasonable evidence now that any amount of alcohol consumption may not be good for your heart, so kind of slowly pulling away from that at this point. Meal plans can be modified to be culture specific. So when you look at these meal plans, I'd encourage you to perhaps recruit your local nutritionist or dietitian to help you make it more culture specific. But I think generally, even though there's the name of the Mediterranean diet per se, these meal plans can be modified to be culture specific. I always recommend that you eat your vitamins unless you are known to have a critical deficiency diagnosed by your physician. I think there's a lot of hype around vitamins and supplements and everything out there, and we have to remember none of these vitamins are FDA regulated. It's a multi-billion-dollar industry in this country, and so probably the preferred method would be to incorporate greens and fruits and vegetables into your diet that will increase your vitamins through your consumption as opposed to supplementing them. Don't try to change your eating behaviors overnight. We know what we call yo-yo dieting is bad for the heart. This is particularly demonstrated in women, and we really want you to focus on a meal plan that's sustainable, and that's why I try to be pretty conscientious of not saying diet when I talk about these things, because I don't want to give the impression that you suddenly have to change everything you're doing about your meal plans, but you want to slowly start to kind of incorporate the healthy parts of your meal plans and take away the things that may not be so good for you mind and body. This is a little bit of an outline of whole food plant predominant nutrition. You can definitely Google a lot of this stuff. The DASH meal plan focuses more on those with high blood pressure, and again the Mediterranean food pyramid, also known to be a heart healthy meal plan. So these are all things that you can consider to kind of modify your diet going forward. Number 2, get active. So this is obviously a little bit of a loaded statement, and you should certainly work with your local cardiology team to figure out what's safe for you when. But as a general consideration, moderate moderate intensity exercise is known to be good for the heart. So you want to try to do 30 minutes. We say most days of the week, hoping that people will try to do it 7 days a week. So what are moderate intensity exercises? Things like walking briskly, water aerobics, biking, tennis, particularly doubles tennis, ballroom dancing, gardening. The high intensity exercise, that's a little bit more, you can see that the American Heart Association has kind of divvied them up. So I'd encourage you to talk to your cardiologist and your local team to sift through what would be an appropriate exercise regimen for you, and at which point after SCAD. But we do want everyone to try to be able to slowly get back into a level of activity that's right for them at some point after a SCAD event. The other thing that I often promote is Tai Chi. Tai Chi you could pretty much do at any point. It's great for strengthening. It's moving meditation. You can YouTube exercises. A lot of communities have Tai Chi classes. It's been known to lower blood pressure, known to reduce falls. It's a really, really nice kind of adjunct to people's exercise and activity routine. In terms of yoga, Pilates, those kinds of things, and perhaps more extreme sports, again, I would encourage you to talk to your local team about what is right for you and what fits for you. There's this really nice outline of the weekend warriors rule, and I like to point this out because for those of us who might be really busy at work and really busy in life, it might feel very daunting to try to incorporate activity into our day. But you can see that even those who work out and do activity even on the weekends do see cardiovascular benefit. So even if you're one of those folks that can't be active every day of the week, there is still some benefit to try and get some level of activity in a couple times a week. And I want to stress again, this is not a blanket recommendation for everyone to go out and play soccer and whatnot, but this definitely needs to be individualized for each patient post-SCAD. But we do want to encourage some level of activity, safe activity after SCAD per your doctor's recommendations. Control your risk factors. So these are all things we already know, but obviously if you're smoking, stop smoking. I would say that I would incorporate smoking marijuana into this bucket as well. So cigarette smokes, marijuana smoke, there's something about the byproduct of smoking that likely is not great for the heart. Control your blood pressure. This is one of the big parts that we're noticing more of a signal for SCAD. So if your blood pressure is running above 120/80 consistently, I would say that requires a conversation with your local team to see if there's medications that should be started, lifestyle changes that should be pursued, or adjustment of medications you may already be on. For those who have high cholesterol, certainly controlling those cholesterol levels with lifestyle changes and with medications, if appropriate, is important. Eliminating inflammation. So those with, I guess we can't, always eliminate inflammation, but controlling inflammation. So those with gout, psoriasis, rheumatoid arthritis, lupus, thyroid disease, it's going to be important to connect with your endocrinologist and rheumatologist to make sure those processes are well controlled. Maintain a healthy weight. That can vary from person to person and varies across race and ethnicity and whatnot. So I'd encourage you to work with your doctors to figure out what seems like a healthy weight for you, and how can you achieve that goal, again, slowly, healthfully, without, kind of the yo-yo diet thing. And then managing your blood sugars for those who might have elevated blood sugars in the pre-diabetes or diabetes range. Number 4, the mind-body connection is real. You know, we published a paper through iSCAD several months ago demonstrating that there is a high rate of post-traumatic stress disorder in patients with SCAD. And this finally really robustly demonstrated how important the mind-body connection is. We know that chronic anxiety, stress, depression seems to have a huge implication on the heart across the spectrum of cardiac disorders, seems particularly important in SCAD. So managing stress, anxiety, and depression is incredibly important. I want to point out here that, we don't want folks to get stressed about being stressed, but there are tools that can be used to modify perhaps your response to stress through things like biofeedback, cognitive behavioral therapy. So I would encourage you to connect with your local docs, your therapists if you have one. I feel like everyone after SCAD should have a connection with a therapist and talk through what are some ways to improve that mind-body connection and that beneficial cortisol rather than kind of tipping over to that excess cortisol that we know negatively affects our body. And again, linked to all cardiovascular disease, not just SCAD, and common after a cardiovascular diagnosis or cardiovascular surgery. And this is what I was kind of talking about in terms of kind of your stress response. So there is this comfort zone where, it's good stress and, kind of the caveman thing where, maybe back in the day, having a fight or flight response was adaptive, but perhaps for us it's maladaptive. So there's a certain level, there's a zone of cortisol release and stress hormone release that's good, that makes us productive, that makes us kind of gives us drive and whatnot. But there is a tipping point where it starts to kind of be maladaptive, cause distress, and cause all of the things that we think about that might have negative effects on our heart and overall health. And so trying to figure out how do I keep myself in that green zone and not kind of tipping myself into that zone that might be have negative effects for your overall health. So strategies for stress reduction, be gentle with yourself. Self-empathy is very important. I think particularly after SCAD, a lot of patients are like, why am I just not back to where I was? I used to do X, Y, and Z before this all happened, and kind of try to push themselves and get themselves back to where they were. So just some self, empathy, kindness, being patient with yourself, letting your body heal and recover and kind of slowly getting back to where you need to be is really important. And schedule for rejuvenation. So here I made this joke at the conference that, in California, we call this forest bathing, i.e. go walk out in nature. So, things like that. Exercise, again, I cannot stress enough, please talk to your doctors about exercise regimen that may be suited for you in your particular situation. We talked about Tai Chi, bibliotherapy, basically read a book, mentioned cognitive behavioral therapy, crafting, journaling, making sure you get 7 to 8 hours of sleep. That's huge. So making sure you're not going to bed too late, kind of trying to get to bed at 10, getting 7 to 8 hours of sleep, making sure you unplug before sleep so that your mind's not racing and all the good stuff that we need to have restorative sleep. Massage, another one that you should definitely talk to your local doc about what within massage is safe for you. There are issues around chiropractic and whatnot for a lot of our SCAD patients, so that should be tailored to a discussion with your doctors. And meditation, Calm app, again, Tai Chi's moving meditation, the meditative parts of yoga, Pilates are certainly important. Practice gratitude and forgiveness. That's been shown to improve overall mental wellness for folks across the board, to kind of thinking through, like in the morning, the little nugget that you're thankful for and the things that you want to forgive that you've been hanging on to. Engaging in spiritual practice, whatever that might mean for you, if that's something that's of interest. Pet therapy. So, having a pet can be really, really a positive change in life for a lot of folks. Nurture a supportive social group. Loneliness is now considered a modifiable risk factor by the Centers of Disease Control, the CDC, and just government body organizations. And so we know, particularly during the pandemic and the aftermath of it, people, social groups have kind of broken down. So trying to kind of find community again. Psychotherapy with or without medication for a diagnosed condition is essential. So again, making sure you're plugged in with your primary care doctor to talk through, do you need a psychologist, a psychiatrist, or both, and how can you develop a care team around that? And we talked about sleep, so natural sleep. Adults, ideally, as I mentioned, should get 7 to 9 hours of uninterrupted sleep. We think about 30% of U.S. adults endorse sleeping less than that. So if that's you, keeping a sleep diary and trying to figure out what might be improved upon to get you better sleep would be important. Poor sleep is linked to high blood pressure, depression, anxiety, insulin resistance. For those of you who think you kind of find yourself gasping a little, or your partner says you're gasping or snoring, or you just feel like your sleep quality is not good, ensuring that you don't have sleep apnea would be important. There are single item sleep quality questionnaires, and you can just basically think to yourself, during the past 7 days, how would you rate your sleep quality? Terrible, poor, fair, good, excellent. You can just kind of think of what comes off the top of your head, and I'd say if you're fair or below, that requires a conversation with your local team. Sleep disruptors, so things to think about. Too much food or drink close to bedtime causes acid reflux and other things that might negatively impact your sleep. Blue light from a phone, computer, television, caffeine and alcohol use, stress, anxiety, worry, certain noises or sounds. We use a sound machine at home. I used to hate it at first, but it seems to really help block out kind of the noise of me just kind of being like, oh, what's that? Particularly if my kids are just making funny noises in the middle of the night. Temperature, if it's too hot or too cold. Lack of daytime sunlight exposure. I use an artificial light during the day in my office. Some people think that helps kind of your sleep-wake cycles. Medications and medical conditions. So there are some medicines that might disrupt your sleep, so it's worth kind of going through your meds with your primary care doctor or your team to make sure there's nothing there that might impact your sleep. And then bed partner and pets. So things to think about in terms of what might be your sleep disruptors. Generally, sleeping aids are not recommended. It's best to try to improve your sleep hygiene. You can consider melatonin, 1 to 2 drops under the tongue, but I would discuss this with your local team first before pursuing, and make sure you're being screened for sleep apnea, as we mentioned. And these are just a list of some of the things to think about. Again, exercise, as long as deemed safe by your local team, may be a good way to kind of help improve your sleep hygiene. And definitely things like caffeine and chocolate and alcohol, particularly at night. Alcohol may make you feel like you've passed out and you're getting good sleep, but it's actually a very restless sleep. So alcohol is notorious for causing just not great sleep. So these are just some things to think about in terms of things to improve your sleep hygiene. Incorporating alternative therapies. Again, these are things to discuss with your primary team. I want to stress again that the FDA does not monitor herbal supplements and those kinds of things, so please make sure to include these in your medication list. They can interact with your prescribed drugs, and so your doc should always know what supplements you're taking. The data's soft, but I'm a big fan of acupuncture, massage, those kinds of things. Again, I can't stress enough, please always talk to your local team about whether these things are safe for you, but they are alternative therapies that can be considered for a variety of symptoms that may be associated with kind of the overall picture of health. And I want to thank you for taking the time. And just another plug for everything that was discussed here. Before pursuing it, I would strongly advise that you speak to your local teams to kind of go through these things, but just a few little tips for overall heart health and overall well-being. Take care. Be well.